Yeah, so I started on the COVID wards, back in April, the beginning, around April, and there was tremendous amount of unknown in the hospital. You walk into the hospital, and for the first time in my life, there was a lot of fear in the hospital. There was great personal risk. Having said that, people really dug in and did their jobs. I never saw a schedule go unfilled. I never saw somebody call out for work. I never saw a problem filling a schedule. I thought I was watching, the modern men and women of D-Day sort of holding society together as things really sort of could have fallen apart. So it was really an honor to be able to work on the front lines. And certainly as doctors, we can control our environment much better than nurses who have to sort of constantly be in the room and taking care of patients. I then sort of contracted COVID, not sort of contracted, I did,
Yeah.
at the end of May, had very high fevers, a very deep brain fog, muscle aches for a couple of weeks, and then ended up in the hospital with pneumonia and blood clots. So it was a scary experience. We don't totally understand what's going on with our lungs. I've said this. I didn't really understand I had pneumonia when I was sitting at home. My oxygen levels were okay, not the greatest, but not horrible. So I was a little bit surprised when they told me I had pneumonia in the hospital. Certainly the blood clots I knew about because I had a ton of pain and couldn't breathe. But I got the best care in the world. I was convalescent for a few months, but was able to work back. And I consider myself one of the lucky ones. I had no underlying illnesses. I took no medications, but I got very seriously ill, which just speaks to the potential viciousness of this virus.